My name is Samantha Wyatt, and this is my speech on CAUTI, and here's my audience, and my husband. All right, gotta go right now. I'm sure you all recognize that as the Universal Potty Dance, and I'm sure you've all done it a time or two waiting in line for a restroom. But what would happen if you had to go to the bathroom so bad that your bladder felt like it was gonna burst and you just couldn't? For a lot of people, that's a reason why they get a urinary catheter. And these catheters can be a pretty scary experience, but they can also help maintain good bladder and kidney function. There also are some negative side effects that come with urinary catheters, and that's what I'm here to talk to you about today. One of the negative side effects is called a catheter-associated urinary tract infection, or as members of the healthcare community like to call it, CAUTI. So today I'm going to tell you what a urinary catheter is, reasons why we place urinary catheters, tell you a little bit about what CAUTI entails, prevention measures for CAUTI, and treatment if you do have an infection. So first, what is a urinary catheter? It's a long, flexible tube that's inserted through the urethra into the bladder that drains the bladder. There's two different kinds of catheters. So there's your straight catheter that is just intermittently placed, drained, your bladder's drained and it's pulled back out. Then you have your indwelling catheter, which is placed into the bladder, secured to the leg, and hooked up to a special drainage system, like this one. And then the bag can be continually drained to maintain bladder function. So why would we place a urinary catheter? So the biggest reason is urinary retention. So that's like what we talked about in the beginning. You have to go so bad that you feel like you're gonna burst, but you know you have to go, but you can't. So this can be caused by an enlarged prostate. So that gland gets so big that urine just cannot flow past it. This can be caused by folks that are paralyzed. Their bladder just doesn't reach the signals from the brain like everybody else's does. So they don't know that they have to go to the bathroom. Or sometimes if you're under general anesthesia for surgery, this will cause the nerves around your bladder to be kind of lazy and sluggish, so you don't know that you have to go. Another reason for catheter insertion is urinary incontinence. So imagine you got your little old lady from your nursing home and she comes in and she's got bed sores everywhere. And she's got them on her bottom and her perineum and she's incontinent. Well, that urine can greatly affect those sores. So we want to make sure that we're giving those a break in time to heal. Also, if you had a surgical site. So another reason would be Barry Hill, in a 2018 article for the British Journal of Nursing, states that another reason we put these catheters in is sometimes people will go to surgery and the surgeries are pretty lengthy in nature, so they'll place the catheter in and they'll remove it after surgery. They can be used for diagnostic reasons, so they can insert the catheter, inject dye, and that can be diagnostic of the bladder itself. And then another reason for urinary catheter insertion is for critical patients. So in these critical patients, we can monitor intake and output, and we can also monitor their temperature for urinary catheter as well. So what is CAUTI? What is this infection? It's an infection caused by the indwelling urinary catheter. So it's usually caused by bacteria or a fungus, and that can enter the bladder in many channels. So the first way is these kits come in a sterile packaging. So it's a sterile procedure. So if you have any break in that sterile field, that can cause the infection. If this was contaminated, if I turned around and a fly landed on my tubing before I inserted it, the germs from that could contaminate the catheter as well. Other reasons for infection could just be not properly maintaining the catheter. If people have large bowel movements and it's on the tubing and it goes into the bladder. If there's reflux of urine in this tubing here, if you're not draining this bag well enough, the urine can reflux back up into the bladder, causing infection. So how do we prevent it? Prevention, number one way to prevent it is to only insert these catheters when medically necessary. So Leslie Nutchen, in a 2014 article about CAUTI, says that we only put these catheters in when medically necessary and not routinely. Used to be if you got a femur fracture or you're immobilized for long periods of time, we just throw a catheter in you. It's so much easier, it's easier on the patient, pain-wise. We don't do that anymore. Research says that's not a good idea because of these catheter-associated infections. Another way to prevent it is special documentation. So the kits come with a checklist, and you must meet every qualification on this checklist before you can proceed to put the catheter in. There's special documentation involved, and 2 nurses must place this catheter. Another way we can prevent it is sterile insertion, like we talked about, maintaining a sterile field. And then lastly, we want to make sure that we're removing the catheter at the earliest possible time. If the patient can urinate on their own, we're going to remove that catheter, and that gets rid of the infection. So that leads me to the treatment. There's two treatment options. Obviously, the first one is as obvious as just pulling that catheter as soon as we don't need it anymore. So if the patient can urinate, let's pull the catheter, or if they have an infection, we'll pull it if they can urinate. Second treatment option is antibiotics, and clinical nurse specialist Kathy Davis in a 2019 study for the British Journal of Nursing tells us that we only treat these caudy infections with antibiotics if the patient's symptomatic. There's too much antimicrobial resistance going on that if the patient is not symptomatic, they just simply change the catheter. So if they are symptomatic, they'll get a urine sample, they'll grow a culture from it, and they'll deem what antibiotic to properly use. So that's it, let's recap. Now you know what a urinary catheter is. You know reasons why we insert the catheter, such as incontinence, urinary retention, surgical procedures. You know what caudy is and what causes it, and how to prevent it and treat it. So I hope that you never take advantage of your ability to urinate. Thank you.